Hello, I'm Kim Harms, and I'm so proud to be here with the Avengers to talk about what do you do after the worst happens? How do you build your team after the worst happens? You know, we've been through a very, very difficult time recently, and our teams, our country, everybody, the world really is stressed out to a degree that we really haven't seen before. And yet all of the things that could have happened before are still happening now. They can still happen. So we pile the current problems that we're having worldwide with the regular problems that used to occur individually. And we're in a tough spot right now. And sometimes major catastrophes can happen in our offices. And we need to know how to rebuild our team to work effectively and to be stronger than ever. Is this really the worst of times? If you talk to someone who's 100 years old, they can tell you about a lot of other times that were terrible in our history. But right now we have a global pandemic. We have a number of economic concerns also globally. We have civil unrest. I live right in Minneapolis, just a few miles from where George Floyd was killed. And that area has changed. That area has changed. And in this uncertain environment, many of our team members are suffering individually. Besides our shared suffering, we have individual suffering. Women can't find childcare, men can't find childcare. Schools are wondering if they're open. Are they full open all the way? Are they open part-time? Is there a hybrid? Is it safe to go to work with all the new variants that are coming out? And people are uneasy right now. When you have the traditional major losses, such as death, which continues to happen, divorce, which continues to happen, or serious illness, which also continues to happen. And we see personal suffering at unprecedented levels. We need to address this suffering within our offices when it occurs and make our dental offices a safe place to be. Most dental professionals, I believe, especially dentists, tend to feel that emotional emergencies are something that kind of take care of themselves. We kind of like to take care of the dentistry, particularly for owners. We like to take care of that dentistry and let those emotional things just kind of take care of themselves. I believe that's completely wrong. I believe it's false. I believe the emotional issues carry through the office at every single level, and we need to address them. Needs to be part of our standard of care. I think conflict management protocols need to be written up in our basic office manuals. I think that we need to discuss and educate our team members about how to manage emotional emergencies when they occur in our office. And I believe that we need to be a safe place to grieve. We'll talk about that later. When you manage emotional emergencies well in a dental office, it improves patient outcomes. The patients are treated with an entire team focused on them, focused on their teeth. It improves patient outcomes. It absolutely enhances patient loyalty because they feel part of a cohesive group. It also greatly enhances team loyalty because team members, all of us, want to work where we're appreciated, we're respected, and people are there for us during the difficult times. Ultimately, managing emotional emergencies well increases office production because everything runs much more smoothly when the emotional issues are managed well. What is a catastrophic loss? Okay, a catastrophic loss, my definition anyway of a catastrophic loss, is a loss that kind of explodes your life as you thought it would be. I think the pandemic was a catastrophic loss for the entire world. We're not used to this kind of interruption. Death sometimes can disrupt our world. Catastrophic loss will explode your expectations, and it'll divide your life into before the loss or in after the loss. Catastrophic loss just completely challenges our identity and what we believe and what we think. And it takes some time for our brains to adjust and to get back focused on our job and our families and our lives. So what about death? Death is definitely a catastrophic loss, especially death of a loved one. And the US in general has a death-denying culture. We live in a spot with a death-denying culture. We don't think about, we don't acknowledge, we don't even talk about death as inevitable, right? It's going to happen. We put it off. We think we can prevent it. You know, we work in sometimes in our hospitals and our hospital team, thank goodness, they are focused on keeping us alive. And they're very good at that. But when the time comes for death, we need to accept that and allow the dying person to take some control in how they proceed and how they die. And a death of a loved one absolutely, absolutely changes our view of before and after. Sometimes also how we respond to our physical decline is also something in our country that we deny. Whether we like it or not, we go into physical decline, and we can help slow that process down. But so far, no one has ever been able to beat it. So far, 100% of us have died. So far, this is one thing we completely share in common with everyone. We are going to die at some point in time. And if we grow old and die, we can do our best to keep healthy as long as possible. But eventually, we're going to die, and we need to address that. And I think the fact that we don't address it makes it so that when it does happen, it's even more difficult to manage. We even have difficulty saying the word death, right? How many euphemisms do we have for death? My favorite is croaked, gave up the ghost, kicked the bucket, didn't make it, departed, or eternal rest. A new one I had not heard before until I did a little research was immortality challenge. That is, I think, a good word. Toes up, resting in peace. Those are all words that we use, the euphemism for death. Other cultures address death in a different way and acknowledge it more as part of life. I have grandchildren that go to a Spanish immersion school, and they, around November 1st, they put up a celebration to those in our family that have passed away. And I believe it's so healthy for them. They lost their grandpa recently, and it is so healthy for them to have some way to express their grief and also express the celebration of his life. So I think we can learn a lot from other cultures in the US on how to address death, accept death, celebrate the lives of those who've gone before us. And why do we use that death-denying language? Well, most of the time, I think it's for emotional protection. It's for our own emotional protection. Death is a scary word, and for the emotional protection of those around us, emotional protection of the people that we're talking to. Typically, when we use a word, we're in a difficult time and we need a little protection. So we use that as emotional protection in many ways. And avoid being rude. It just sounds softer. We can soften the word. Maybe croaked is not the right word. That's not a softer word. So don't use that in a time of sorrow. But softer words, I think, are more helpful when we're grieving. And I think that partial denial, we kind of like to deny that that's not happening, and somehow death happened and we're surprised. I think, of course, it does happen in surprising times, but sometimes, especially in someone who is an elderly person who has experienced a long and slow decline, it might not quite be the surprise, but we've been in denial. I've experienced that myself. I can talk from firsthand about denial. And I think it's kind of human that we do that because it's an inevitability that we don't always like to think about. And as much as we would like to believe otherwise, death happens. And frequently, death happens unexpectedly. I experienced that myself the first time at 17 years old. At 17 years old, I lost my mom, Anna McKernan. Now, my mom and dad had been divorced since I was 3. She actually suffered from bipolar disease and was in a mental institution at the time of her death. She was a wonderful, wonderful, wonderful mother. I could not have asked for a better mother. She loved me unconditionally. She loved me unconditionally. And I really believe that the relationships I developed later on in my life came from those 6 short years that I had with her. And in fact, if you take a look at some of the new research out about attachment theory in children, you will find that the attachments and ability to identify with someone and be loved by someone in those first few years of life will affect how we respond the rest of our life. So I give my mom credit for 6 years that I had with her physically. At 6 years old, she went into an institution and she stayed there until her death when I was 17. My mom was emotionally affected by the drug thalidomide. When she was pregnant, they were testing it in a small area in Cincinnati, Ohio. My dad was in the Navy. She was driving across country. Her friend had been taking thalidomide for morning sickness for pregnancy. She gave mom a couple of tablets and I ended up missing fingers when I was born. You can see from this picture, she had beautiful hands. She was actually a hand model. And it affected her the rest of her life. It was a loss for her. And when she found out that about thalidomide, which wasn't until I was about 6 years old, that grief is and the grief and the guilt and the sorrow is what put her into the institution to begin with when I was 6. When I was 17, my mom, still in the institution, but on an outpatient basis, she could go out during the day and work and come back at night. But when I was 17, my mom took her life. And that was such a horrendous experience. I can't even tell you. For those of you that have survived suicide, you know, the grief, the guilt, the shame, all of those things. My life was devoted to saving her. I was going to be a psychiatrist, so I was going to save my mom, you know, and I just can't even tell you how my life exploded. That was my first catastrophic loss. That's the first time I can divide my life into before and after. And she also suffered, one of the problems too, is back in the 50s, the treatments for bipolar disease were pretty brutal. One of them was electric shock treatments without anesthesia. At least now we place patients under anesthesia typically for electric shock treatments. In those days, they didn't. So she had some very, very brutal treatments. Her life was very, very hard. She suffered quite a bit. But her loss at 17 completely changed my life and my reason, really my identity, my reason for being at that time. I had a son, Eric. Eric was a wonderful son. He was so kind and giving. He loved his friends. He loved his family. He loved his God. And his loss left us devastated. He also took his life when he was 19 years old. He took his life like my mom did. And Eric was one of those kids. He was just a golden boy. He was at St. Thomas Academy here in Minnesota. He was the drum major. He was the guy that brought everyone together. He was in theater. He was, you know, the lead role in many of the plays. And he loved people so much. He was so emotional. He was also a very gifted jazz pianist, which made him very impulsive. It's a great trait for a jazz pianist, not so good when it comes to your emotions. Eric went to Columbia University. He was actually recruited by Columbia. He was a National Merit Scholar, very brilliant young man. And he got to Columbia and he was so happy his first semester, so happy. He had been elected to student government at Columbia. He was playing in the jazz program. He had worked in some plays and he was on the dean's list in engineering. That was his subject he was studying. And he was in love. He was in love. And 2 weeks into his second semester, his girlfriend broke up with him, which she should have done if she didn't love him. He was in love, maybe not so much for her. And 45 minutes after the breakup, he was gone. He was gone. And our world completely fell apart. My husband, Jim, and my world and my family's world completely fell apart when Eric died because there was so much guilt on our part. What did we do? Did we not? Could we have prepared him better for this? What could we have done? Fortunately, and I would like to recommend this to all of you. In our family, the last time when we talk to someone, almost every time on the phone, before we go, we say, "Oh, I love you, bye-bye." So fortunately for us, Eric's last words from every member of our family, my husband, my 2 daughters, was that we loved him. That's a huge help when you suffer catastrophic loss. In fact, preparing those relationships before a loss are so helpful in grieving the loss. When Mom died in 1974, death by suicide was considered, and still to a certain extent, but very, very much so then, shameful. It was considered shameful. to the point where we couldn't find anyone to hold a church service for her because it was considered shameful in those days. We saw her casket in a deep, dark mortuary lined up, and it was just dripping with shame. You could feel the shame kind of coming off the walls. It was dripping. It was dripping. And I remember that as a 17-year-old. Now, my mom was the most amazing, wonderful, kindly, godly person you had ever known. She really was. And that left a huge impression on me. But fortunately, things have changed. Things had changed when Eric died. It is service. The Catholics, the Baptists, he went to a Catholic school. We were Baptists. Everyone got together in the same church. They bussed. The interesting thing was Eric was no longer at St. Thomas Academy. He was in Columbia. He was a student. He was a senior. He was a freshman student at college. He was no longer at the high school. He was no longer there. Yet they bussed hundreds of kids in dress uniform. It was a military academy. Dress uniforms, bussed them to a Baptist church for this funeral, for the funeral of someone who had taken their lives. Imagine the change. Imagine the change. The orchestra played, the band played. It was an amazing funeral. In fact, our church, we have a big church and it was overflowing. We had to have video in other small rooms around the campus. It was an absolutely incredible funeral. And the greatest gift was paid to me at the end, because as we rolled Eric's casket down the aisle, those young men, tears running down their eyes, and I can't even talk about it still without goosebumps, tears running down their eyes, stood along the side of our church and saluted Eric. They saluted Eric. And so they showed me the changes that have taken place. Eric's life meant something. His life was valuable. They were honoring Eric's life, not his death, not how he died, how he lived. What a change. And I'm telling you this story because I want you to know that things are changing, and they're changing. This is about a 35-year change, but that's a pretty rapid change in how we manage suicide today, and how I was treated by our church personnel, how I was treated in the general population. Things changed dramatically, and that is very, very helpful. We also had a memorial at Columbia. So Columbia University, he'd been there for one semester. But again, because he was in student government, he had made such an impact that they put in a permanent memorial for him. There's a beautiful shad bush planted in the middle of New York City at Columbia University. They made him an honorary member of the graduating class of 2012 in engineering. And I was so grateful for that. You have no idea what those things do to help people who are recovering. So again, first catastrophic loss when I was 17, second catastrophic loss 35 years later. Whenever you have a death by suicide, you have to realize it's sudden, it's shocking, and it's deeply disturbing. This really could be any sudden death. This really could be any death at all. I think whenever you have complicating factors like suicide or murders, I have friends whose children have been murdered. When you have those complicating losses, it complicates your grief. It makes it harder, it makes it deeper, it makes it longer. There are many, many conflicting emotions, particularly in a suicide. I mean, I was angry at Eric for doing this, but I loved him so much, I just couldn't stand it. I understood, because I've been to that dark place myself, went to it with my mother. I know that when a person is in that position, they feel that everybody else is better off without them. Their brains are changed. Their brains are not working. Their brains are being fed lies. And that's how they act. So I understood that in that time, he was just so pained. He had suffered so much pain. He just wanted it to end. And he didn't know how to manage it. We'll talk later about brain chemistry, but there's a reason for that. His brain was not fully developed quite yet. There's guilt, there's anger, there's shame, there's anxiety. Who was the common denominator between my mother and my son? Me. I was a common denominator. Must be my fault, right? Must be my fault. I was a mother. Why did I not prepare him to manage breakups or whatever else he might have been going through in those last 2 weeks? There are many unanswered questions, particularly when you have a death that is sudden, and we're working in New York, and we there were so many unanswered questions about how this could have happened. And we had to manage that. We had to manage it. Answering those questions would not bring Eric back, and trying to come up with a plan that in your brain, trying to get your brain to come across that idea that you're not going to know all the answers. You're not going to know all the answers. And some things you have to accept without knowing. Surviving death of any sort can lead to major depression. Psychological trauma definitely causes psychological trauma, and post-traumatic stress. And of course, with my mother, I had that double tsunami of complicated grief. I was still grieving my mother. I had not really worked through that very well. At the same time, I was grieving my son. It's a very difficult time. I was also still practicing. And we'll talk a little bit later about how you manage going back to work when your brain can't think straight, when you can hardly breathe. How do you go back to work? It's a difficult problem. My life divided up again. I have 3 traumatic losses in my life, and that was the death of my husband, my dental partner. We've been married for 44 years. I married Jim when I was 19 years old, and he passed away just last year. But he had been sick for a long time. He developed liver cancer right before Eric died. In fact, he'd had a liver transplant 6 months before Eric died. And we were trying to manage, as we tried to manage all of these traumas in our lives. After Eric died, one of the things that Jim did is he's a stubborn Norwegian. He would not admit that he was having psychological issues. We all were. But I think Jim's life and his death, he died of congestive heart failure, which I believe was precipitated by his unresolved grief with my son, with Eric. He grieved his loss every minute of every day, as I did. But I was treated for depression. Jim was not. And he ended up losing his life due to congestive heart failure, which I believe was associated with Eric's death. So these things are all connected. And I would really like to ask all of you that are suffering from depression, it's a whole different story, but suffering from depression, that you get treated, because the physical losses are terrible as well. I would also like to ask all of you to make sure that you establish a living will. When Jim died, we went into hospice, which was amazing for him. Jim decided through a living will that he did not want to die in a hospital. He wanted to die at home. When we knew his heart was giving out, we knew they weren't getting better. He'd been in a hospital for a long time and he was not getting better. He wanted to be home. And through a living will, he was able to make that decision. I am so grateful that he did that. My grieving would have been harder if I had to make decisions that I would later question. If with him making the decisions, he didn't have to question. I didn't have to question. I knew it's what he wanted. It made things so much easier at the time of his death. There are several things you can do at the end. You can do everything possible, and you can include that in the living will. You can say, put me on the machines, keep me going. I want to see if any miracle can occur up until the very end. Do everything possible. And if you say that in a living will, the people that are around you, your loved ones, can do that knowing that that's what you wanted. You have to ask questions like, does a patient want to be resuscitated? Do they want to be on a ventilator? Another option in a living will is palliative care. That basically is comfort care without really curative intent, which means we're going to take care of you. We're going to keep you comfortable. You're not quite dying yet under palliative care, or you're not at least admitting that you're dying yet, but we're going to just kind of keep you comfortable. We may not do treatments that are uncomfortable for you, like an intubator or doing CPR, which can cause some chest problems. You can break ribs, especially in older people. We're going to just treat you in a palliative way, keep you going as long as we can in a palliative way. The next one is hospice care, and hospice care begins when doctors can conclude that you've got 6 months or less to live. Now, are they always right about that? No, people come out of hospice too, but that's another decision. Jim chose hospice because he knew from being in the hospital that he was not getting better. In fact, he was still declining. He chose hospice, and we had hospice at home. He wanted to be home. And that was a really amazing privilege for me to be here to help my husband work through his death through hospice. I'm so grateful for that. It was during COVID, which actually made the situation easier, because I had learned before COVID, I didn't really know that you could stay in your house 24 hours a day and get groceries and get whatever you needed. You could actually do that. Before hospice, I thought, well, you need to take a break to do this and do that. And we kind of learned during hospice that it is actually possible to stay in your home 24 hours a day for as long as you need to stay at home. Not the most comfortable thing, but I'm so glad I learned it. It made everything easier for me. And Jim chose hospice, and it was his choice. And I think that's the thing, that's the importance of having a living will for people that pass away after, for your loved ones. It's for you and your loved ones. Death is very different. Jim's death was very different from Eric's death. Jim's death was pre-mourned. We pre-mourned his death for 13 years. And Eric's death was post-mourned. It was sudden. It was catastrophic. We post-mourned his death. Jim had, for the 13 years after Eric died, Jim had other problems. He had diabetes and had some serious issues. We were in the hospital many times. He suffered from septic shock, was in a coma, almost died. He had several heart situations where he was in the hospital, almost died. He was actually written off at one point, but then got a special transaortic heart valve, which was fabulous. And so we faced his death every year except for 2. And the reason I remember that there's 2 is that when he had his birthday during those last 13 years after Eric died, when he had his birthday, twice we celebrated that, hey, he hadn't almost died that year. All the other years, we would celebrate his birthday after a very close brush with death. So we were pre-mourning his loss for 13 years. Is one loss worse than the other? No, they're both catastrophic losses, but we may mourn them differently. And this is a point that I'd like to make for everyone in a dental office. Everybody mourns differently. Everybody mourns differently, and we can't predict how we're going to mourn over the loss of one of our family members. Life of grief in a dental office many times is secret. Why is that? Well, unlike many other offices, when we go to a dental office, when we're working, we have to be there, focused on those teeth for every single patient that walks in that door. If the patient walks in that door and sees that we can hardly stand up, do you think they're going to trust us to take that drill and go in and work on those tiny teeth in that mouth with moving parts? You think they're going to trust us? No, they're not. No, they're not. So life in an office must be done kind of behind the scenes. And we have to fake some things there, which is really hard, and which is why it's so critically important for dental offices to work together to help support the team member that's grieving. Because they can't go back to a cubicle and cry that, throughout the day. They can't go back and show their grief on their face as much. You're going to show it to a degree, but you have to try to play that strong role, which is very, very, very difficult in a dental office. So how do we do that? One of the things that I think that I love C.S. Lewis, and one of the things that he said that I thought was so right on was that perhaps a bereaved ought to be isolated in special settlements like lepers, right? Because people avoid you when you're grieving. People don't like to be around you sometimes when you're grieving, right? They don't know what to say. It's not that they don't love you, it's that they don't know what to say. And we need to change that protocol around in the dental office and embrace the bereaved. We need to embrace the bereaved, whether they're team members or their patients. We need to make them know that the dental office is a safe place to be. So what do we do to help our team members after a catastrophic loss? First of all, we have to understand how we process grief, and that grief takes time. It doesn't go away. I have to admit, in my own head, I had a wonderful dental hygienist that I love dearly. She lost her son to suicide after breakup. He was 17 in high school still, several years before Eric died. And I remember in my head thinking, I never expressed this, thank goodness, but in my head, I remember thinking, it's been like 3 years. Is she, did she come out of that yet? It's been 3 years. Okay, shame on me. Shame on me. She needed time. She needed time. I needed time. We all need time. But we have to help them live and work in our offices. Be present with empathy. We're going to talk a little bit more about empathy later, but empathy is that feeling that you're with her, you're in the well. You're in the well with your team member. Be present for them with empathy. Maintain trust. Trust, again, is another issue. Could take several more seminars for that one. Building trust before something bad happens is so important in maintaining a team afterwards. So maintain your trust with that patient, with that team member, let them know what's going on and how you're feeling. Provide backup in a safe environment. What do I mean by that? Many times in a dental office, there is no backup, right? Depending on how big your office is, sometimes there's no backup in a dental office. So how do you provide backup? You work as a team in the morning. I hope you're all having morning huddles. In the morning, you work as a team, and yet somebody comes in and they're suffering from grief, and you say, Mary, how are you doing today? Use that today, because how are you doing? They're doing rotten. How are you doing today? Are you doing a little better, a little worse? How are things going today? Because every day is different. If they say, oh, I'm really having a tough day, I'm going to get through, I'm going to put that smile on, I'm going to do my best, I'm having a tough day. Have some backup in place, have a signal, because every day in a dental office, you have patients coming in that are going to express their sorrow to you for the first time. For the first time. As a dentist, you've got your patients and you have all your hygiene checks. Every one of those is a trigger sometimes for grief. I'm so sorry for your loss. Yes, and you remember, you're trying to get back on your job and you keep getting thrown into the grief pit. Same with hygienists, same with dental assistants, same with front desk staff, that there are people that are coming in and they're going to say, oh, I'm so sorry. I heard about your husband. I heard about your son. I'm so sorry. And that's going to keep playing out day after. You can't escape it. You can't just go back into a cubby. So provide a backup, provide something. If this happens, someone will fill in for a second. You can go and, get your breath and come back in, have a backup. The emotions of grief, it's important for you to know, are physically painful. It hurts. You can't eat. You can't sleep. Your heart feels like you're having a heart attack all the time. Sometimes you can't breathe. You can't take any type of outside commotion. I couldn't watch movies, for a long time. I couldn't watch TV. I certainly couldn't listen to any type of news. I just had to get rid of all of those outside distractions for me for quite a bit of time. So know that the emotions of grief are physically painful, but when you're dealing with your team. And the physical consequences of grief are very similar to that of depression. What are those? The immune system is weakened. Pain is increased. Pain and grief, physical and emotional pain, are closely connected. They go through the same parts of our brain. They're processed through the same parts of our brain. Pain is increased. I have arthritis. It gets worse when you're suffering. Inflammation is increased. Lack of concentration. It's hard to focus when you're going through grief, same as depression. And irritability. So just understand that this is what your team member is going through and work with them to process all those. Part of your brain you kind of feel has flown the coop, and you might be going along just fine and you get a trigger and you just fall out. I remember I can't remember, probably once or twice a day I'd be in the stairwell. I'd be in the stairwell just crying my eyes out, trying to get myself back together before I could get back in and work. Very, very difficult. And you need to have a staff that understands it. You feel like the Walking Dead. You're walking around, you're walking around. Your outside is there, people can see you, but the inside, your emotions are dead. You just feel like the Walking Dead. You feel like you can't, you're just going through the motions, and inside you can just hardly work. Every ounce of your being is focused on just moving and going through the motions. It's hard to process things and to concentrate. You feel like the Walking Dead. So you might have team members that come in looking like the Walking Dead. You need to help them at least have a Walking Dead with a smile on their face as much as they can. You might have to try that, okay? But that's very hard. Understand that's how they feel, and they might feel that for a while. The neurobiology of trauma is absolutely fascinating. It has shown so much in the last maybe 10 years. There's been so much new information that's fabulous, and it talks about what goes on in your brain when you suffer trauma. And emotional grief is trauma. It's trauma. You are suffering trauma to your brain. And much of that trauma, the primitive part of that trauma, is processed in the part of your brain called the amygdala. It's two little almond-sized spots in your brain, right kind of in that lower base of your brain, the primitive brain. And the amygdala is what managed a fight, flight, or fear freeze mechanism. It's what kept you from being eaten by saber-toothed tigers back in the day, and when there's danger, you can run. We don't do as much running from danger now. Most of our danger now, fortunately, is emotional danger. And so some of the fight, flight, and freezing mechanisms emotionally work certain times, especially the freeze. I like the freeze, gives you a chance to talk, freeze, process, like that freeze part. But the fighting and fleeing, not necessarily is helpful sometimes in today's day and age. It triggers our emotions. It processes anger, it processes fear, it processes memories, past memories. It plays a huge role in our survival instincts, and it's involved heavily in PTSD. When our patients are in the chair and they're remembering past dental experiences, that is being triggered by our amygdala. It's a very active little piece of our brain. I kind of made this into a cartoon here because this is how I see the amygdala. I see the amygdala as kind of a little bit of a mischievous part of our brain. It's important, it's mischievous, and it's ready to go at any time, just like a mischievous kid. And it's to alert you of danger. It plays a major role in processing that anxiety and fear. And if the fight, flight, or freeze reaction is inappropriate for the situation, you might find yourself overreacting, and you may suffer an amygdala attack. Now, many of us have been through amygdala attacks before, haven't we? We have been through amygdala attacks. We have been through times in our lives when we just feel like everything is out of control, right? Amygdala attacks. It also processes the part of the brain that's not always helpful. It's rumination, that ticker tape. You focus on, especially when you get angry. Oh, this is happening. Why should you do this to me? Back and forth, back and forth, back and forth, back and forth. It's that ticker tape. Oh, rumination is mind poison, and that's processed in the amygdala. Funerals, weddings, happy gatherings, counting children, PTSD, brain games, all of these things are processed in the amygdala. When Eric died, 2 of my PTSD triggers were New York and Columbia. I love New York. I love Columbia. Columbia was a wonderful university for my son. He loved it there. He loved it there. But those 2 words just triggered me. And so I would go through the day, and do you know how many times New York is talked about during the day? It is everywhere. You can't turn on the news without hearing about New York, right? New York, New York, New York, all the time. But Columbia was even worse. There's Columbia, the country, Columbia, the city. 28 cities across the United States are named Columbia. Columbia, the space shuttle, so Columbia Pictures. And for me, one of the most common ones was I would be having a good day. I'd be in my bedroom talking to my husband. I'd be going through my closet, and all of a sudden I would see Columbia Sportswear. Columbia Sportswear on one of my shirts, Columbia Sportswear. And what would I hear? I would see Columbia Sportswear, and I would hear, "Your son is dead." That's what I would hear. And that would trigger an emotional response from Columbia in my closet. I actually had to take it away for a few years. I'm over that now. I'm over that. I don't do that anymore. But for the time, I had to take all the Columbia stuff and just put it away because I just didn't want to be triggered anymore. Every time I went through my closet, I saw Columbia. And that's what happens to people in your team. They may be walking along, having a good day, and all of a sudden something triggers them, and they have an amygdala attack, and there they go. And of course, rumination, prison, and all of this PTSD is controlled by fear. We are afraid. We fear. We live in fear. And we have to try to control that. That's a terrible place to live. Fear is a bad place to live. When your amygdala goes a little crazy, one of the new things that has come out, in the research is that a super sour candy really if you focus on the sour taste of a sour candy, that can help get your amygdala triggered out, especially if you're having an anxiety attack. Have an anxiety attack and you just need to get your brain refocused. Sour candies can help. Isn't that amazing? And now sour candies are terrible for your teeth. They are the trifecta. They have a low pH, they're acidic, they have sugar, and they stick to your teeth. So not so good for your teeth, but occasionally a sour candy to help you get over an amygdala attack. Make sure you have good oral hygiene after that, but sour candy can help. Find a focus object. When you're in your office and focus on something, try to get that out. Sometimes you're in the middle of treatment of a patient and something might happen, and you got to focus on what you're doing, focus on that tooth, focus on what you're treating. That can happen too. Practice mindfulness. Mindfulness is very, very helpful when it comes to taking care of anxiety and fear. Take deep breaths, big deep breaths, and even if you have to maybe get out of the chair for a couple of minutes, take a few deep breaths and come back in. Count to 10, always helpful in your head. Don't count to 10 out loud. They don't know what you're doing. Count to 10 in your head. You're trying to mask the fact that you're going through an amygdala attack typically. And fortunately, we have parts of our brain that also help when it comes to an amygdala attack. That is our prefrontal cortex. The prefrontal cortex is great at calming the amygdala. It is terrific. The unfortunate part about the prefrontal cortex is that it doesn't develop fully until about the age of 26, 27, especially in males. My son, Eric, did not have the advantage of a fully functioning prefrontal cortex when he died. His amygdala was going crazy, no prefrontal cortex to calm him down. That's why this is such an important concept for me, why I focus on it so much in my seminars. It calms the amygdala and is involved in complex decision-making and rational thinking. So fortunately, we have the prefrontal cortex and we can focus on that prefrontal cortex. We can train that prefrontal cortex to take over and the amygdala is attacking us. I kind of see the prefrontal cortex as kind of our hero, right? The amygdala is a little mischievous one. The prefrontal cortex is a hero, and it's a control center for the amygdala. And so it can overcome that anxiety. So I think focusing, strengthening your prefrontal cortex is so important. When it comes times where things like PTSD, or when you're ruminating in your brain, what's really happening? Well, that amygdala of yours is acting up. The amygdala is taking that fear and it's pushing you into the pit time and time and time again. And when I picture this pit, the top part is kind of anger and anxiety. It pushes you into those pits as well. Depression is a mid-level, but that horrible, horrible, horrible bottom of despair. And being in despair is a terrible place to be. My son and my mother were in despair when they died. Being in despair is a terrible place to live. And so what we need to do as a team is help our team members climb out of that horrible, horrible pit. And it's going to take some time. When you have despair, you're down there, you feel like you just hardly breathe, and maybe your nostril is above, you're choking, you're drowning in the pit. And grief, sadness, and fear are going to keep you in there. And amygdala will keep you in there. So again, train your prefrontal cortex, focus on that prefrontal cortex, strengthen the prefrontal cortex. And there are people today in the Avengers that can help you do that, to ask for help. And it'll just pick you out, and maybe not quite so quickly, but it'll do that. Of this pain is very difficult. And some grievers get stuck in the pit and they never make it out. I remember history. I love history. I love British history. I love Russian history. Very, very wonderful, amazing history. And Queen Victoria was stuck in her pit for years, and she kept her grandchildren, her children, her grandchildren that went to rule all of the other countries and played a big part in World War II in that pit. I wonder what might have happened if we could have gotten Queen Victoria out of her pit a little earlier, but that didn't happen. It is difficult. I found out about fighting out of the pit, using my prefrontal cortex to fight out of the pit by a cousin of Jim's. It was about maybe 2 or 3 weeks after we lost Eric and we were back at work. And while we were back at work, I'd come out and I was in the zombie stage. I was walking out in the zombie stage. I walked out to our front parking lot, and there was Jim talking with his cousin Carrie. And Carrie had lost his brother, Jan, when he was 19, same age. So they were discussing that loss of a son, loss of a brother. And Jan had been out drinking, and he'd been out with his friends, and his friends had left him in the back of a car in front of his house because he had passed out. Now, unfortunately, I live in Minnesota. Jan lived in Minnesota. It was 26 degrees below zero that night. And so Jan froze to death in the back of his car. You can imagine the sadness, the loss, the blaming, the shaming, the guilting, all the things that went on after that loss. And Carrie's parents could never get out of the pit. They could never crawl out. They were stuck. They were stuck in that pit. And Carrie felt the brunt of that. And this happens many, many times. Carrie felt he had lost his parents as well as his brother. And this is not an unusual experience. In fact, the divorce rate after loss of a child is astronomical, very, very high. So when I walked out of that office and I walked over to Carrie, Carrie took his finger and he looked at me and he pointed at me and he shook his finger and he said, "Don't you ever let your kids feel that they are not enough. Don't you ever do that. Don't you ever do that." And this is not something you can normally tell to people who are suffering grief, particularly in that early stage, in the zombie stage. You have to be very careful. I'm telling this story to you as a group who I do not know, as a general method for getting out of the pit for you. And any help you can be to other people to get out of the pit, but don't point your finger at people that are grieving, because the first reaction you would normally have is you're what are you doing? You are judging how I grieve. How could you do that? I just lost my son. How terrible are you to, put salt on the wound? This is awful, right? That's what you normally say. But in Jan's case, it worked because he was right down in the pit. He was showing empathy for me. He was in that pit with me, and I could see it in his eyes when he said that, because of what had happened to him. And when he said that to me, don't dare let your kids feel they're not enough, I realized I had a job to do. It struck me like a ton of bricks. And I love my two daughters, and I realized, yes, they need me too. They can't lose their parents. And I resolved at that time that I was going to do everything I could to get myself out of the pit so I could be there for my other two children. And when you're down in that pit and you're looking up and you're looking around, basically all you could see is blackness. It is a black, horrible, horrible place. Please don't stay there. But when you're down there, it's black, it's terrible. It doesn't look like there's any way out. And you can very easily feel defeated. That's the go-to position. Don't let that happen. Don't let that happen. Because if you look up, the first thing you need to do is really look right up, right down the center, out of the pit. There should be some light up there at some point in time. And what you will see is that there are people up there in your lives, people that you love, people that you care about, that will help you to get out of the pit, that want you to get out of the pit, that you need to get out of the pit for. And use every single solitary bit of energy you can to climb out of that pit. And again, you can't judge anyone else on this. It might take months, it might take years, it might never happen. You might only get halfway out of the pit, but keep working at getting out of the pit. So, after we've been through that, how do we help? Now that we understand what's going on, hopefully a little better, how do we help those that are in grief? When someone suffers a loss, the first thing to do is show empathy in body language, action, and words. Show them you're with them. Empathy means stand alongside them, be in the pit with them. Let them know that you understand to a degree. You can't understand it fully. Please don't say, I understand where you're coming from, because you don't. Just say, oh, I'm so sorry. I'm so sorry. I'm here with you. Don't try to fix things you can't. We want to fix things. We want to make them feel better. We can't. We can't fix things. We can only be there for them. Being for them makes them feel a little bit better. Help in practical ways. And specifically, one of my very dear friends lost her husband just 3 weeks after Jim died. And we've been friends for years. He was an oral surgeon. We were friends for years, and Jim died, then he died. Larry died. And I remember when Jim had died, that one of the things that we didn't have, we had a lot of food that was brought over, which we were so grateful for, but we didn't have a lot of breakfast things, not a lot of things for breakfast. And in the morning, there just wasn't a lot of support in the morning yet, as people were getting up and getting on with their day. So early in the morning, I went over and I picked up some quiches and some croissants, and I got some coffee, and I brought it to her house, and I put it in a bag. I put it in a refrigerator bag, put it on her step, because I didn't want to wake her up. She wasn't ready for me. I wasn't announced. I didn't want to surprise her wherever she was, right? So I put it on her step. I got off in my car about a block away. Then I texted her, just want to let you know, I just left some quiches. I didn't want to bother you. I'm here for you. Just want to let you know. And she texted me, oh no, come in, Kim, come in. So she was up. And so I went back, I came in, and I sat there for probably about 2 hours while she cried. And I just put my arm around her. And she later told me that was a really important thing that I had done. And I was so grateful for that. It's those little things, don't get in their space too much. Do specific things. Don't ask them to ask you what they need, because they don't know what they need. They might, that might help. Maybe ask for some specific things you want. Is there anyone that needs to go to the airport or come from the airport? Can I take your trash out? Can I do this? Can I do that? Ask for specific things. Don't expect them to think. They can't. Their thinking is not working. Thinking is not working at that time. So don't ask them to make decisions at that time. It's hard. When they're at their office, after they come back to work, surprise them every once in a while, maybe with a cup of coffee or tea or some sort of comfort item to make them feel better. Let them know you're thinking of them. Just let them know you're thinking of them. That is such a big help. No platitudes, no at least statements. Don't say, well, at least this, or at least I never, please ever say that. That really that doesn't help. That doesn't help. It doesn't help. You can say that to yourself. And I say that to myself all the time. At least I don't live in a third world country. I say that to myself. I would never say that to somebody else. Just be careful, because that minimizes your level of pain that they're going through. And tell a positive memory about someone who is lost. Tell them a story about their loved one, how that person affected you, what they did. Tell them the story. The stories are the best. You can tell them the story or write them a card. Writing them a card sometimes is even better, because they can keep the cards. They can remember those, because you don't really remember a lot. The first year after Eric died, I can't remember much of anything. And the same as, shortly after Jim died as well. So just remember that their loved one in a card or in writing or in person even. And include memories, in a card, include other memories in the card about how that person who passed away made you feel. So what do you say to someone who suffered a catastrophic loss? What do you say? What do you do to make them not feel like you want them in a leper colony, right? What do you say? You say, I am so glad you're here. Okay, I am so glad you're here. Please remember this. This is a go-to statement for when you meet anybody, really, but particularly someone who has lost someone, because the first thing you're making a statement about is, I see you. I am glad you're here. Thank you for showing up. That's what you're saying. And then once you've established that you're happy to see them, then you can go into, oh, I'm so sorry for your loss. Talk about the loss after that. I would also recommend you have some things in your toolkit, in your emotional toolkit for the office. So I'd like you to prepare an emotional emergency toolkit, the workplace edition for your office. Develop a bereavement plan. Let people know before somebody dies what the expectation is in the office, because you need to be consistent. You can't let one person get more days off than another person. You need to be consistent. What is a bereavement plan? What do you do? How many days maybe paid leave? How many days unpaid leave? Is there a way you can share leaves? What can you do? Develop a bereavement plan. Have a crying safe room. And this was a bathroom for us, because there are going to be times when you've suffered a catastrophic loss that people are going to need to just go into the restroom and get themselves together. And that means eye drops, tissue, makeup remover, anything that's going to help kind of get you back to looking like a human being and not as much like a zombie when you walk out the door. I always, of course, include chocolate. That's my go-to item. The amygdala attack plan, they have some of those sour candies, or something back there for emergencies when your amygdala attacks. Memorial pictures in the team room. I think that is a wonderful thing when the entire office can help to bring back the memory of the one that's lost and share in that memory. Team donations. Team can donate time. They can donate food. They can donate money. If there are team donations, that is so helpful. Full team empathy education. This is what I mean. There's a great Brene Brown. Please go to Brene Brown's website and look up her empathy material. They're fabulous. They're fabulous. And they teach you how to walk alongside someone who is going through pain. And the main feature is in one of her videos that I just love, there is actually it's a little fox. It's situated, it's going in a pit, kind of like my pit of despair, but hers is a well or a pit. It's in the pit, it's in the darkness. And there is a bear that comes alongside to have empathy with that person and to make them feel that coming from their place of vulnerability, that they have a connection with them. I'm feeling your pain. I'm sorry for your pain. I'm going to sit here with you. I'm going to acknowledge your pain. And then there's someone else. That's empathy. There's somebody else, got a little giraffe coming from the top, who's showing sympathy, which is, oh, I'm so sorry. You want a sandwich? And what if, at least, all those things. So be the one that sits beside. Be the one that sits beside and helps that person get through. Now, beyond empathy is also a concept called attunement. And attunement means you take your empathy one step further. You take your empathy and you focus on, what can I do to meet the needs of this person? When you become attuned to what the person needs, that's when you might be able to help. I think I was attuned to what Teresa needed. I was able to help her when her husband died, because I had just been through it. So attune yourself to where that person is and find something that would help you. So where do you want your team to live after a catastrophic loss? Where do you want them to live? And I think that's really important to think about. Do you want them to live in a safe place? Do you want them to live in a place that helps them become calm? Where do you want your team to live? And strengthen your team by helping your co-workers who are struggling. When you can help your team struggle through a loss, when you can do that, you are a stronger team. You are a better team, and you're going to be able to face new losses when the next one arrives. So bad things happen. You can't control when they hit, but you can control how you manage them, how you prepare for them, and how you work with your team to help them. So build your teams, build them through hardship, and you're going to end up stronger at the end. Thank you so much. This has been, again, an honor to be here for the Avengers. If you have any questions, just go to my website, thedentalmediator.com, and you can go through that site to ask me any questions. Just email me some questions. Thank you very much.